think you might have multiple sclerosis. Your doctor is going to do many tests and examinations to help make that diagnosis. Dr. Robert Shin will describe how this might proceed, and it's important for you to remember that the goal here is to diagnose a MS early, because early treatment leads to the best outcome.
How do we diagnose somebody with multiple sclerosis? There have been really two basic principles in diagnosing someone with MS. We talk about dissemination in space, and we talk about dissemination in time. What does that mean? So in terms of dissemination in space, when we say that term, what we mean is when I'm evaluating someone who might have MS, we focus on whether I can find different abnormalities on the neurologic exam, meaning are we seeing evidence that there has been injury to the brain or spinal cord. So if you've been to a doctor or a neurologist, you may have had them shine a light in your eyes, or maybe they're tapping on your knees and your elbows with a reflex hammer. Maybe they're using a tuning fork to check sensation. Maybe they're having you follow their finger for eye movements. All of that is part of the neurologic exam. And to be diagnosed with MS, we really, classically, would like to be able to show at least 2 different areas that have been affected by the MS. The other part of it, the dissemination in time, what does that mean? Really, what we're looking for is evidence that something is changing across time. For instance, in multiple sclerosis, it gets its name because patients with MS have multiple different neurological episodes. So I'm really going to look for a history of someone having had different episodes in time. That might mean, for example, a common scenario would be a young woman who suddenly develops some blurring of vision in one eye. She might think, oh, I thought there was something on my glasses, or I was trying to rub it out. And that might evolve to some vision loss in that eye with some discomfort or pain on eye movements. That might be an episode of optic neuritis. Now, that's one episode. On the other hand, maybe that person recovers from that and later on develops numbness or tingling, or maybe some subtle form of imbalance or weakness. Well, that might be a second episode. So this idea of change in time, episodes, but also affecting different parts of the nervous system is really the hallmark of how we're diagnosing MS. Now, if you've been evaluated for MS, I can almost guarantee that you've had an MRI scan of some type of the brain and or spinal cord. The reason for this is what we've discovered is that MRI is a wonderful tool to get a better picture of what's going on in the brain and spinal cord that's actually even more sensitive than my own neurologic exam or your history. What we've learned is that for every episode that an MS patient has, we can find up to 10 spots showing up on the MRI scan. So it becomes this very sensitive tool. So when a doctor's worried that you might have MS, they often order an MRI scan, and we'll look at that for the same things, dissemination in space and time, meaning can I find multiple areas of demyelination, white spots on the MRI, and do they appear to be changing in time? That can be shown by either 2 different MRI scans, or sometimes even on a single MRI scan, I can see evidence of an old lesion and a new lesion. So in a nutshell, that's the information your physician is collecting or your healthcare provider is collecting to make that diagnosis of multiple sclerosis. Now, again, if you've been evaluated for MS, you probably had some additional testing, including blood work, because there are a lot of different things that could mimic MS that we need to rule out. So your blood test often does things like rule out vitamin deficiencies or other inflammatory disorders or maybe certain kinds of infections. So that's part of the workup of MS. But there is no actual blood test that identifies MS. It's really more to exclude things that are not MS. Many patients who are evaluated for MS will also have a lumbar puncture or spinal tap. This is a test that honestly I'm doing a little bit less often, but for a patient in whom the diagnosis is not clear, that is additional information that may be useful for me. One question is, why is it so important to diagnose someone with MS? There was a time not long ago where doctors, neurologists hated to make a diagnosis of MS because, as I said, before the early 90s, we actually could not treat multiple sclerosis. So it was something where, again, patients are typically young when they see us, and we were really reluctant to label them with something that we basically could not treat and that we believed would be associated with a lot of disability. Today, because we have so many treatment options, in some sense, I'm excited to diagnose MS. Not that I would want anyone to have that diagnosis, but if I can identify MS in a patient, especially if I can identify it early, I can offer them a really good chance of having a very mild effect of that MS over time. So what I'm trying to say is diagnosis is extremely important, and the earlier we diagnose people, the sooner we can talk about treatment options. And our evidence has shown us that the earlier we treat MS with our more effective products, the better people can do in the long run. I mentioned earlier there was a time when we would tell patients that there's a high likelihood that they're going to end up in a walker or wheelchair because they have the diagnosis of MS. I never say that now. From my point of view, if I can identify someone with MS and get them on the best possible treatment for that individual as early as possible, I believe they're going to have a very healthy and relatively symptom-free life. That's really the goal when I'm treating patients with MS, and I would like to convey that I think that at least as of the 21st century, we have a lot of hopeful options in treating this disease.